But let's talk about a few important things. Why would sometimes you get cases where people want to be possessed or really believe that they're possessed, and when the exorcist or the priest tells them that they're not, they get very frustrated. And the flip side can happen. Sometimes people come to me and they say, Dr. Sandoval, I'm feeling depressed, I'm feeling anxious, I'm feeling all these things, I think I have schizophrenia, I'm hearing voices, you got to put me in the hospital. And once I talk to them, I say, no, you don't necessarily need to go into the hospital, we can take care of this here. And sometimes people will get disappointed. Why is that? Well, I'm going to go through a little bit about why that can be, and as we go through, then I'm also going to go through some cases where we discuss the criteria for depression, anxiety, psychosis, bipolar disorder, so we can see kind of how the psychiatrist thinks and how I make those distinctions. A lot of times when people want to be sick, sometimes we call that factitious disorder. They don't know that they're doing this. They don't necessarily consciously know that they're trying to get attention. But let's see if this sounds familiar. Somebody comes to me and they have clever and convincing medical or psychological problems that they've already self-diagnosed. That's one of the keys for me. Somebody comes up to me and says, this is what I have. It's kind of like when people go to the exorcist and say, I've got a demon, I need an exorcism, and this is the way I need you to do it, and I need you to go through these steps. We've already self-diagnosed, right? Sometimes we pray that way for God. God, I want to do your will, and let me tell you what your will for me is. We do that a lot, right? So I get that too. Sometimes we call that the internet patient. So the patient will come to me and they'll have an internet printout of all the symptoms they have and all the medications that they researched and which one I need to prescribe for them, right? And that's okay. I don't mind. I say, hey, let me see your research. Maybe you're helping me out. Maybe you did a little work for me. So, okay, let's look at your research, because I need to know where you're coming from, right? I need to know, that's the first thing I need to know if I'm going to decide, how is this person influenced? Is it diabolic? Is it mental health? Where are you coming from? And I want to listen to what you have to say. What about extensive knowledge of medical terms and diseases? I researched this a lot. To me, that tells me you're pretty smart enough to research it. I already think you don't have much of a mental illness, but you're going to tell me you convince yourself you do. Okay, well, let's go with that. I think people, priests and exorcists are going to see that too. People come and they say, I've got all these symptoms of oppression and vexation and all these things that I have. Look at this scratch on my arm. No, it wasn't because I was in the rose bushes working. It's because the demon put that scratch on my arm, right? People come to us and they have this extensive knowledge. They've done a lot of research. I think that's actually a good sign, but people get disappointed saying, no, this is convincing, right? And I say, well, it's convincing of a few things. What about conditions that get worse for no apparent reason? This is starting to get worse. Now that, you could say, well, yeah, that's coming maybe from the diabolical. But you got to remember, if this is the person's story, where are they coming from? I've been in deliverance groups where it gets a little bit questionable or dangerous because sometimes the energumen, or whoever feels they're being possessed, comes and says, I'm the victim of satanic ritual abuse. And then nobody questions that. And I say, well, what do you mean by that? Well, my dad was really mean to me. Well, hang on a second. That's all you've got. So we got to make sure that we get a good history. We don't want to fall into the trap of thinking whatever the person says, that's what it is. Not because I don't want to believe them, but because I got to remember they're coming from a place of hurt and they're going to experience life in a little bit of a different way, whether it be perceived trauma, a real history of trauma, or whatever they experience in life. The other thing that I ask and I question is, well, what kind of treatment have you gotten? A lot of times with people who really want to get that attention, they're seeking treatment from many different doctors or hospitals. How many times have I heard, well, I've seen this many psychiatrists and none of them are right. I said, well, gosh, you've seen 10, 20 psychiatrists. How many times do we see an energumen saying, I've seen this priest and this exorcist and I flew to this country and I flew to this city and none of these exorcists could figure it out? Well, then maybe it might not be a diabolical possession. What are we treating here? Another one is frequent stays in the hospitals, because people will go to the emergency department with mental illnesses and say, I think I want to hurt myself, I want to end my life, I'm hearing voices. If you say the right things in the emergency department, I need to make sure that you're safe. I've met you for the first time. Let's say that we're doing an emergency visit. I need to bring you into the hospital. But you've had about 20 hospitalizations. for the same thing. You'd think we would have gotten something right by now, right? I think the same thing happens when we talk about deliverance. Gosh, I've been to this many priests, I've been to this many churches, I had this manifestation 50 different times in front of people. Well, let's talk about it. It's not that I don't believe they're in pain. I know that they're in pain for some reason, but I got to evaluate what is it that's going on. So the first thing I do when I do an evaluation is I say, well, let's look at the history. If I do a mental health evaluation, what's your family history? Well, doc, I've got to be possessed. Well, anybody in your family have any psychiatric issues? Well, my dad was depressed, and his dad was depressed, and his dad was depressed, and my aunt on my mom's side is depressed, and my uncle has schizophrenia. He tried to commit suicide. Well, maybe we're dealing with mental illness. Maybe we got a situation here where you have inherited mental illness, right? We talk a lot about the generational sins or things of that nature, or, well, what about just normal inheritance in our biology, right? We come into mental illness. Sometimes the answer can be simple. Sometimes it's complex, or the treatment can be complex, but the reality is maybe you're just dealing with a depression or an anxiety that can be treated, that we can address. A lot of times I think people really want it to be something more because we're looking for meaning in our lives, because that's how deep my pain is. If my pain is so deep, my anxiety is so deep, then it's got to be something very, very powerful affecting me. It must be something diabolical, something I can put my hand on. It can't be the fact that I'm not living a Catholic life. That's too simple. It can't be the fact that I don't go to church on Sundays. That's too simple. No, that can't be it, because my pain is so deep. And I say, yeah, your pain is deep, but sometimes the answer might be as simple as going in front of the Eucharist. Maybe you don't even need medication. We got to remember that we are tied all at the same time between our body and our soul and our mind. It's all happening at the same time. Whatever I do to my body is going to affect my mind. Whatever I do to my mind can affect my soul, and vice versa. If I sin, can it make me feel bad? Absolutely. If I sin, can it make me feel bad without there even being any diabolical influence, but just the fact that I sin? Yes, because my soul is hurt. My soul is in pain now. It doesn't mean that the demons are after it. Well, they'll be after it if you're in sin, of course. But it doesn't mean that I'm being diabolically influenced necessarily. We have to remember, just being in mortal sin puts us away from God. How happy can we feel? How healthy can we feel if we are already separated from God? And sometimes just going to a good confession, sitting in front of the Blessed Sacrament for an hour, as you'll see in one of these cases, might just do the trick without anything else happening. And so these are the things that are important.